We have come so far in the fight against HIV. Today marks 40 years since we learned of the disease we now call AIDS for the first time. It was noted in a CDC report on this date in 1981. President Biden marked the anniversary by naming a new director of the White House Office of National AIDS Policy. He also released a statement recognizing the more than 700,000 Americans and nearly 33 million people worldwide who have died from AIDS-related illnesses. Mr. Biden also acknowledged that the pain of many AIDS victims went unacknowledged for far too long. Before it was AIDS, it was GRID, the gay-related immune deficiency. That's because that first CDC report focused on 5 otherwise healthy young gay men in Los Angeles. They contracted an illness called pneumocystis pneumonia. It took years for the government to respond to what many saw as a gay disease. It took more than 4 years for President Ronald Reagan to even say AIDS in public. It took almost 6 years for the FDA to approve the first medication, AZT, and it often caused some nasty side effects. Compare that to our amazingly effective COVID vaccines. It took less than a year to make them available, and only after years of research leading up to this pandemic. Today, around 38,000 Americans are diagnosed HIV positive each year. Antiretroviral drugs make the disease much more livable. In fact, as long as treatment keeps the virus undetectable, research shows it cannot be sexually transmitted. Joining us now is Jeffrey Crowley. He's Program Director of Infectious Disease Initiatives at Georgetown's O'Neill Institute for National and Global Health Law. He's also a former director of the White House Office of National AIDS Policy. Professor Crowley, welcome to the program.
Thank you, Joshua, for having me on. Thank you for spotlighting this issue.
Oh, for sure, particularly because there's some concern about what it will mean for the fight against HIV, considering how much COVID-19 has really drawn on a lot of our healthcare infrastructure. What is your sense of where we stand with the fight against HIV today?
Well, I think that COVID is a setback, but I also think the way that the HIV response has really helped us in responding to COVID shows the interconnected nature of infectious diseases and other public health problems. There's no way we would have made the progress we did on COVID but for the research investment in HIV research, the infrastructure, the healthcare providers, and the community response with HIV that helped respond to COVID. But I also look at how quickly we developed these vaccines for COVID, and I think we need to take inspiration. You know, NIH and others have invested heavily in HIV vaccine research, but it's a much tougher virus to fight. But I think we need to be inspired and you know, say by 2030, we're going to have a vaccine for HIV.
What do you attribute that to? The Pfizer and Moderna vaccines use this new technology, mRNA technology. We had Dr. Anthony Fauci on the program a few weeks ago, and he said that he was optimistic that we could make some strides in the fight against HIV based on some of the success we've had in the fight against COVID.
No, I think that's right. I mean, first of all, this is a new technology, and not only in HIV, in a number of areas, it's potentially a game changer. This could be like when we introduced penicillin, and it just changed, you know, the role of infectious disease in the world. But Dr. Fauci has been talking for decades, and recently I've heard him talking about a functional cure. And I think mRNA vaccines are one tool. He and others often are getting excited about advances we're making in broadly neutralizing antibodies. And there's a number of things that we need to do. We just need to keep pushing and investing, and some of them will pay off.
Why do you think we have not yet either eradicated or beaten into submission HIV yet? In 2021, with all that we know, with dramatically increased acceptance for LGBTQIA people, why aren't we done with this yet?
So it's a much harder virus, but it's not just the medical problem, it's a social problem. You know, your intro spoke of GRID, gay-related immune disease. You know, we used to talk about the 4 H's, and patients, homosexuals, heroin addicts, and people with hemophilia. So we baked stigma into the response from the beginning, and we're still dealing with that. HIV is still highly stigmatized. So it's not just about, you know, giving people treatment or giving people medicine to prevent HIV. It's about dealing with the marginalization and the stigmatization of LGBTQ people, but, you know, trans people, especially people who use drugs. We need different approaches to respond to these social crises as much as medical crises.
Yeah, I think we've come a long way in the last few decades for sure, particularly since the death of my uncle, Jonathan Griffin, who I'm thinking of today. He died of AIDS some years ago, and I remember the feeling at his memorial and how loving but somber and slightly uncomfortable it was just to even kind of have conversations about that kind of thing. It feels like we've come farther civically in terms of talking about it and governmentally, with President Biden requesting $670 million from Congress, which is up about $250 million from previous requests. How hopeful are you that we're going to get this beaten? And if we are, what's going to make the difference? Is it the funding? Is it our ability to talk about it publicly? Where's the linchpin as you see it?
It's all of those things. You know, our country and the world has a lot of problems. And I think one of the challenges we face is sustaining our response. You know, as COVID shows, HIV is not the shiny, exciting new thing to work on, but we still need to keep investing in HIV. If we pull back, we'll see more HIV infections. We're already starting to see more infections from people who inject drugs, but we're concerned that COVID could cause us to pull back. If the funding declines or we don't actually keep increasing as necessary, we won't make the problems we made. But I also think, you know, in addition to the money, it's about the community. It's about, you know, if we've learned one thing with HIV, it's if we've got to talk to the community. So if, you know, Black and Latino, gay and bisexual men are about 1% of the U.S. population. They represent about 40% of new HIV diagnoses. So we can't just respond as though everybody gets the same response. We need to work with people in those communities and really turn to them for their leadership to make a difference. We need to do similar things when we're talking to people who use drugs, to transgender people, to women. And it's this community response that's really critical to our past success and our future success.
Georgetown Law Professor Jeff Crowley, I appreciate you making time to talk to us on this day. I do believe that we are going to make AIDS history one day. The more that we talk about this and the more that we're honest about the lives of real people and how they can protect themselves. But for now, I appreciate your time. Thanks very much.